Hello and welcome to this daily briefing. It's Monday, March 9th, and I'm Ed Marins, the Chief Clinical Officer for Dartmouth-Hitchcock Health. And with me today again is Dr. Antonia Altamari, our hospital epidemiologist and infectious disease expert here. We've had a busy weekend that our team has met and has been on site and working across the organization and in contact with the state. And we've got a lot to update you on in terms of what's happening. I know there's been a lot in the news, but we want to give you information as you can plan your visit here at Dartmouth-Hitchcock and understand things in the context of everything that we're doing. So the most important thing is that there was an announcement by the state that there were 2 additional cases in the state of New Hampshire. While the case that was identified in Rockingham County was thought to be related to travel and not related to the Dartmouth-Hitchcock cases or the cases that we've seen in the Upper Valley, the additional case which was identified as someone who attended the Hope Bible Fellowship church service on March 1st was related to one of our previously diagnosed cases. So what's important to know is that this contact happened at the time when the person who transmitted the virus was completely asymptomatic and was diagnosed later on. We'll have more about that as we talk about chain of transmission and how contacts are handled. But the state has contacted all the people that were attendants at the church and those that were present at a coffee social prior to the service. So we've got a number of topics that we want to get to. The first is kind of some measures that we announced yesterday at Dartmouth-Hitchcock about limiting gatherings here at Dartmouth-Hitchcock to less than 50 people. And there's been this discussion nationally around social distancing. We're learning a lot of new terms as this virus rolls around, and this is a new one. And the CDC's guidelines are around how groups can come together, how we should think about how far apart we are, and recommendations that organizations consider. We've already seen big changes with sporting events and national meetings, but we've made some decisions here. And can you talk a little bit about how we're thinking about in terms of gatherings here at DH?
Sure. I think what we know about most viruses is that they're transmitted via droplets, and we know that droplets can carry as far as 6 feet. And so when the CDC is recommending social distancing, what we're really talking about is maintaining a distance of at least 6 feet from each other. This is generally good practice, especially if someone is ill. Of course, what we really want to emphasize is that if you are sick, you do not go into social gatherings. And if you do happen to sneeze or cough, it's done in the elbow, such not as to not contaminate your hands and then continue the spread of diseases. So at Dartmouth, we had made a recommendation over the weekend that we would limit large gatherings at the institution. This could be institutional conferences, this could be external conferences coming on site, to make sure that we're maintaining a safe distance from one another, especially if anyone is ill.
I want to talk a little bit about this whole thing about chain of transmission. There's been a lot, sometimes we tend to think about people as being, I'm sick, and then I come in contact with someone and they get sick. And what we're learning about COVID-19 is a little bit different. Can you talk about that a little bit?
Yeah, so this goes back to something we had mentioned in one of our earlier videos, that coming up with a definition to know kind of who is at risk has been evolving over the days and the weeks that we have been learning about COVID-19. What we do know from other viruses, in particular influenza, is that you can transmit, and you're the actually most contagious 24 hours prior to when your symptoms develop. So when you develop those body aches, that fever, that cough, the sore throat, the runny nose. So in fact, you don't even know you're sick and you're transmitting to others. And this has become really important with COVID-19 as well, because what we're finding in the cases we are seeing is that our cases are transmitting to others when they didn't even realize that they were sick yet. And so our definition of close contact has always been people we have contacted who were potentially exposed 24 hours prior to symptom onset for our cases. And to reemphasize the fact that all of our cases in our area of the state have been related to our initial infected person. So that chain of transmission from person 1 to person 2 to now person 3, we can very, very much describe as all related and confined. We do not right now, although this changes day to day, have any evidence that we have community spread outside of the incident that we know about.
Can you talk a little bit about what it's like living with someone who's quarantined, and what the guidelines state about what we should do.
Yeah, so the whole reason it's really important for us to come up with that definition of who's a close contact is because as soon as we identify someone who is suspect of having COVID-19, we put all of those close contacts into quarantine. That means they go home and they are not to come out into public where there are large public gatherings. We've had lots of questions about whether one could go out of the house, for instance, to take trash out or to get the mail. And the recommendation is, of course you can, but stay more than 6 feet away from others. So the whole idea of this is that we are protecting or preventing ongoing spread of disease. So what one does is in quarantine is take their temperature twice a day and monitor for any symptoms. So we're really trying to break this transmission cycle by keeping everyone safe and keeping those who were exposed in quarantine monitoring actively for symptom development for 14 days. And again, those 14 days are recommended because we think most symptoms and most infection occurs within 14 days of exposure.
Great. I think when we think about taking out the trash and getting the mail, we expect that being either outside your door or at the end of your driveway, not the post office box or the transfer station. So I think the CDC would say, avoid those kind of environments. Let's just talk about the environment in the hospital. We are, as we've said in all our communications, is that we're open for business. Patients are in the hospital, people are in the ICU, getting operations, having babies, and people want to visit them. And what precautions, I know we should talk about kind of sanitation in the hospital and how you should think about visiting people in the hospital during this time.
Yep. You know, Dartmouth-Hitchcock puts out recommendations at the beginning of what we call respiratory season, and we monitor this closely throughout the year when we start seeing an increase in cough amongst patients presenting to clinics. And the instructions that go into effect then, which really started back in October, were to limit your exposure to the hospital or to your loved ones that are potentially at higher risk of becoming ill. And this started in October for us, where we said any visitors coming in to visit patients, please postpone your visit if you're feeling ill. And this is really there to protect not only the patients, but the healthcare environment, the healthcare workers, and preventing that spread of infection, whether that's influenza or the common cold. We are still recommending that. That hasn't changed, but perhaps more strongly saying, if you are ill, please don't come in if it's for a social visit. If you need to come in because you are ill, call ahead to your provider and let them know. And remember to let them know of any potential exposure to a COVID-19 case or any relevant travel according to the CDC travel restrictions.
Super. I think given the weather we've had for the past couple of days, people assume that winter's over and colds and flu and everything is going to go away. And I think it's important to note that this is not necessarily going to go away. And we see other viral illnesses like influenza that continue into the spring and sometimes the summer. So even though the good weather is here, we are still dealing with this, and we will continue to do so. We firmly believe this will be one of the viruses that will continue on and will be facing probably for the weeks or months or in an ongoing fashion. We have a hotline, 603-650-1818, for if you have any questions about COVID-19 and what you should do. And we hope to be able to come back on a regular basis to answer more questions and talk about where we are with the Dartmouth-Hitchcock response. So on behalf of Antonia and myself, have a good day, wash your hands, and we'll be back again.